Hello, everyone, and welcome to today's Facebook Live with GBMC Healthcare. Now, today we are talking about the future of primary care. So let's welcome our guest, Dr. Robin Matter-Mast, Medical Director of Primary Care and Population Health at GBMC Health Partners. And remember, we want to hear from anyone watching, so please don't hesitate to ask your questions. Now, welcome, Dr. Matter-Mast. Can you explain to us telehealth? Is this really a new thing for the medical field?
Well, it's not exactly a new thing, but it definitely has found some footing as a result of COVID-19. So telehealth is telecommunications, which means that you're corresponding or seeing patients either through audio or video technology.
Right. And it seems like we've all gotten familiar with that. I had a telehealth appointment yesterday. What are some of the challenges of telehealth? And then how is GBMC Health Partners addressing them?
Yeah, there's been definitely some challenges as there was a very quick ramp up. We were lucky at GBMC. We had been preparing for video visits and telehealth for over a year. So in February, prior to COVID-19 really hitting this area, we had been working on this project. So we were really ready to go. But when COVID-19 did hit and we had to go full throttle into video visits or telephone visits, we had to get very resourceful very quickly. And we had a wonderful Epic team that was very supportive and was able to get through not just primary care, but also through our specialty practices and get them set up really quickly. Some of the challenges that we had were Wi-Fi, the platforms that our patients were using. So we love our patients to use MyChart, which is through Epic. It really gives us access to do some other work besides just seeing the patients, but maybe having the patients help us collect the information about their health, do some questionnaires online, get them checked in more efficiently. So those are things that MyChart is great for, but not everybody has the ability to use MyChart, or the patients didn't always want to use MyChart. Some of them found it a little too complex for them. So there were other options that were made available to us through the government, things like FaceTime. And I think a lot of us are used to using FaceTime on our Apple devices. But then again, not everybody has an Apple phone. So we had to look for other sources of ways to connect with our patients. So we did things like using Skype or Doxy.me, which were apps on the computer. And then Doximity also came to the table later on with a platform that is similar to FaceTime, but you can use it from another device, not just from an Apple device.
All right, all of those good things to know. What was really at the core for the need of telehealth since the start of the pandemic?
The real need was just to keep everybody safe. So the patients wanted to be safe, and the staff and the offices wanted to be safe as well. So none of us knew what was going on. We heard all kinds of information on the news, and we wanted to protect ourselves. So telehealth was a great way of still obtaining your medical care, because just because there was a pandemic in this country didn't mean that people still didn't need to have health care. So of course, the first things that people thought about were, well, I'm not going to go to the doctor's office. I'm not going to do my routine care. And then what about those patients who had some follow-up care scheduled? Maybe you had hypertension and you were due to come into your physician's office to see how your blood pressure was doing. Those were maybe lower on patients' agendas of things to do. But then there were the acute visits. So there were things that happened to us every day. Maybe it is you hurt your back because you were at home trying to do all that painting in your house as you were quarantined, or not quarantined, but even just the stay-home orders that the governor put in place. All of us were doing all these home projects. It was spring and there was landscaping going on. All kinds of things that happened and then required some type of semi-emergent visit to the physician's office. So these visits really became something that we were able to access through telehealth and see our patients and then decide if we really needed to see them in the office or not. We never closed our offices completely to seeing patients in the practices, but there was definitely a 2 to 4 week period of time where we were trying to keep everybody out, but still offer the healthcare that our community needed.
So that is one thing. How important is it for people to still get in touch with their doctors, especially, like you said, the blood pressure medicines and some of those follow-ups? How important is it to do that even during everything that's happening with COVID-19?
It is so important that people don't put off their health care. It's been 3 months now. So if you can imagine, just some self-neglect going on, if you have some type of chronic illness that you needed to have treated, you really need to make sure that you are following up with your providers. We've made it very safe, not only through video visits, but also through the reopening of the practices. So we tried to limit the amount of patients that are coming into the practices at any given time. Of course, following social distancing in the practices, doing more cleaning than we've ever done in the practices, in the waiting rooms, in the exam rooms, removing magazines, toys, books, anything that could have contamination on them, putting plexiglass into the practices to create barriers for the staff and the patients to be safe. But video visits, again, if anyone has any reservations about coming into the practices, video visits are a great way for us to help see our patients still.
So you're definitely reminding people that getting that care is still vital during this time.
Yes, and I thank you for helping to remind them as well.
Well, thank you. So what is some of the feedback that you've gotten from your patients about telehealth? I'm not going to lie, I was a little hesitant at first when my son had to have one, but then I liked it. They were really able to kind of interact, and then I was able to show pictures and everything else. So how are a lot of people responding?
A lot of people love telehealth. So it's much easier. It's not as time burdensome for a patient. So if you have an appointment, you have to leave work sometimes, then you have to sit in the waiting room, then you have to sit in the doctor's office, and then you have to go maybe get some blood work or pick up a prescription. So not to say that you don't have to do those same type of activities, but they're really kind of on your own terms. So as you're waiting, it could be in your home and you can get other things done while you're waiting. It could be in your car and you're spending time maybe looking through your emails or making other phone calls. So it really gives patients back a lot of their own time, and it's made it much more efficient for the patients. The patients have also commented that they were really surprised that they were able to get the same information out of the telehealth visit as when they came in to see the provider in person. And they felt that the office visit went more smoothly for them. And I think we had 92% say that they were willing to do it again. So they really liked it.
And what about the providers? How do the doctors feel about telehealth?
It's mixed. It's very interesting. So the providers really love the relationships with their patients. It's really important for them. And some of the older providers, I hate to discriminate with age, but it did seem to be that the older providers who are really more established in their patterns of seeing patients in the practices really still prefer to see patients in the practices and lay their hands on the patients. Where some of the younger providers were much more comfortable with the technology and felt like they could get the same information out of the visits. From a provider and patient experience, I think that it really it enlarged or it allowed patients to understand more about physicians to understand more about their patients. So when I do a video visit, I can see somebody's home and I can see what their home looks like, and I get more of a sense of that person. And the same thing because of COVID-19 and all of us working at home, a lot of the providers were doing video visits from home. And right. The patients would love it when their kids would pop in or their pets would, bark, and they were able to get to know the providers on a much more personal level.
Right. Well, so that is a good thing. I'm hoping that mine doesn't pop in now, but so
it's okay. We're all used to it now.
Right. Well, listen, if you hear a superhero fight, know that that's what's happening on my end. But so it seems like it's actually helped, right? It paints a better picture all around of everybody, from the providers to the patients.
It does, and I think it removes some barriers for people to get healthcare. So, of course, anytime you have anything that's new technology, and you have to learn how to use it, it can be a little bit of a stumbling block to get started. But once you do it and you see how easy it is, you really think, wow, why haven't we been doing this for a longer period of time?
Right. So that's just it. So now moving forward, it's changed everything, right? We never thought that TV people could work from home, and yet here we are. So going forward, will it change things for the future of healthcare? What are some of the hopes from the doctors and the patients when it comes to using telehealth in the future?
Well, I have some doctors who say, I want to just do telehealth forever and not stop. Right. So, and I know some patients feel the same way. But I do think that the insurance companies are really important in this conversation.
Yes.
So I think I told you that we had been trying to do this for over a year before COVID struck. And one of the limitations for us was that only 2 insurance companies were paying for telehealth visits at the same rate as seeing patients in the practice. So unfortunately, finances do come into play, and we do all have to pay the bills. So if insurance companies would continue to pay for telehealth visits the way they are today, that would allow us to even further this technology. There are some things that we need to do better with. Remote patient monitoring is one of those things. Mm-hmm. So we talked about blood pressure follow-ups. Yeah. So we do need to monitor people's blood pressure. This is just one example. So there are scales, there are glucometers for people with diabetes, blood pressure cuffs. These are all things that we have access to in our homes. And some of those things actually connect through Wi-Fi devices, and that information can then be shared electronically. Mm-hmm. Currently, the federal government doesn't allow us to count that information. And when I say count, that means most of us participate in advanced payment programs, and we're being held responsible for quality measures. Those right. Quality measures, something like a blood pressure being checked, can only be obtained in a face-to-face visit in a doctor's office. So if I can't get you to come into my office and have that blood pressure done, then I actually don't get credit for managing your blood pressure. And that's really just silly. So we should get to the point where we have approved devices that allow us to transmit this information into the doctor's offices. And then all of us get credit for it. That way, we also know that the information, hopefully, or the instruments that you're using are calibrated and considered appropriate for gathering that type of information in the home and are accurate for us to help make decisions that we need.
And so that is another thing, just talking about disparities in healthcare. Do you think that telehealth can kind of help limit those?
Yeah, I think you could probably have 2 answers to that. Yes, because if transportation is an issue for you, it can definitely help to limit that disparity. But if you can't afford to have Wi-Fi in your home, then that would be a limiting factor. Also, we found that you do need to have a smartphone or a computer with a webcam. So again, if finances are an issue, that could be a limiting factor. But most of us in this day and age, even if you go to foreign countries that are third world, a lot of people are running around with smartphones. So mm-hmm. We know that the smartphone and the Wi-Fi technology is there.
And then one thing, so you mentioned talking about the age difference between some of the providers and doing telehealth. But what about the patients? Because my dad is 75 and had to have a telehealth appointment last week and was like, they want a what? How are the patients responding?
Yeah, so we did some deep dives into that to see what the age distribution looked like. And we were really surprised. We found that between 10 and 15% of all age buckets really broke out almost equally into doing telehealth visits. We did have a little bit of a decrease in the 85 and older population, which was down to about 8% of our patients, but we probably have fewer amount of patients in that age range to start with as well. But as long as you make the platform easy to use, so FaceTime, we know it's really easy. You just hit a button. But moving forward, once we get through this COVID period, we're going to have to see what the insurance companies deem as HIPAA compliant. We all want to make sure that we're protecting our patient information. So which platforms will really still be available. But that is key. We have to make it easy to use for the patients and for the office staff who's using it on the other side.
And so why would it be that difference with insurance companies as far as covering the telehealth? Is there a reason that you can provide?
Well, I think change is always hard and people are skeptical about what really happens. Mm-hmm. So they worry about fraud, or is it really as good of a visit as it is if they were coming in to see a provider? Mm-hmm. They want to make sure if they're paying you the same amount that the level of service is equal. And I think, we have some great information now that we can share. We've done surveys with patients. There are surveys available through patient experience tools. And if payers are looking to validate that experience from a patient experience perspective, they most certainly have resources available to them to do that.
Okay, so going forward, telehealth is nothing to be afraid of, right? For any of the viewers who may be a little hesitant, can you walk them through what happens from the beginning of your telehealth appointment until the end?
Absolutely. So if you want to set up a telehealth visit, the first thing you would have to do would be to schedule it. So you can call your office. Still at this time, usually when you call an office, they've been doing telehealth now or video visits. So they're going to ask you, would you prefer to have an in-office visit or would you like to have a video visit? Then once you say, I want a video visit because it was so great, I've heard so many wonderful things about it, we will set you up for a video visit. Then prior to your visit, they will check your insurance, make sure that we have the right information on available in our system. They may collect your copay, although copays have been waived by a lot of insurance companies during this period. I understand that towards the end of July, the copays will be coming back in for most insurance companies. I think that seems reasonable, as long as it's not a COVID-related incident or visit that you're looking for. And then once that is done, usually the medical assistant will call the patient the day of the appointment, an hour or two before, just to check in, make sure that that patient has everything they need, their IT is set up, whatever platform they're using is working, and gather some information, just like they would if you were having a rooming session during a regular visit. So they may ask you your vital signs, especially if you're coming in for a follow-up on blood pressure. Do you have a blood pressure cuff at home? Could you tell me what your blood pressure is? Do you know what your weight is? Do you know what your heart rate is? So that's information they can gather. Then, of course, they're going to talk about what medications are you taking? Have you had any new problems, any new allergies? And then they'll just confirm that the physician will call them at the designated time for the appointment. Then at that designated time, the physician will go online to join the patient online, and they'll do their visit. It's as simple as that.
It sounds like, well, I've done it, so I know. But is there a certain range? Maybe people think my specialist won't do a telehealth visit. Is that true?
No. Specialists have been doing telehealth visits at really high rates. So the bariatric physicians here at GBMC have some of the highest video visits of anyone in the whole organization. And gynecology, who would have thought that you could do a video visit through gynecology? But they have been doing a lot of video visits as well. And then, of course, oncology really is more about symptom check-in and seeing how you're doing and trying to make any adjustments in your treatment. So that was something that was really easy for them to adjust to as well by doing video visits.
Okay, so from I scrape my arm, can you look at this or check out this mole over here, all the way up to the very serious stuff, we can count on GBMC Health Partners, right?
Absolutely.
Okay, and so one time before we go, just tell everybody who may be watching again how they can contact you or any doctor to get a telehealth visit if they need one.
So you could look online, since we're talking about telehealth, your physician's website will have information about doing telehealth visits. If you have a MyChart account, you've already signed up through Epic, our electronic medical record, you can actually go online and schedule a video visit that way. Or you can just simply call, just like you did before, and ask for a video visit. And the person answering the phone will make sure that they get you set up for a time that's convenient for you.
All right. So exciting. We thank you so much, Dr. Robin Matter-Mast, for joining us today and giving us the whole scoop on telehealth at GBMC Health Partners. We look forward to talking to you again soon. Thank you.
Thank you.